In today's demanding work environments, the concept of workplace wellness has moved from a peripheral perk to a central strategic priority. Yet, many well-intentioned programs fail, resulting in wasted resources and employee cynicism. This insightful book cuts through the hype to present a clear, evidence-based framework for creating initiatives that genuinely work. It argues that success hinges not on flashy, one-size-fits-all solutions, but on a thoughtful, integrated approach that aligns with core business objectives and, most importantly, respects and understands the unique workforce it aims to serve. The journey begins with a fundamental shift in perspective. Truly effective wellness is not about forcing employees to participate in isolated activities like step challenges or lunchtime seminars. Instead, it must be woven into the very fabric of the organizational culture. This requires moving beyond a program managed solely by the Human Resources Department to a philosophy embraced by leadership and reflected in daily operations. The book emphasizes that leadership commitment must be visible and authentic. When executives actively participate and champion well-being, it sends a powerful message that health is valued, creating a ripple effect throughout the company. A critical pillar of this approach is the move from assumption to data-driven understanding. The authors stress the importance of first listening to employees through surveys, focus groups, and health assessments. What are their specific stress points? What health goals are meaningful to them? Do they struggle with financial anxiety, caregiving responsibilities, or a lack of connection? By gathering this intelligence, organizations can move past generic offerings and design targeted interventions that address real needs. This participatory process not only yields better program design but also fosters a sense of ownership and trust among staff, increasing the likelihood of engagement. With a clear understanding of employee needs, the book guides readers through designing a multidimensional strategy. Effective wellness transcends physical health. A robust program nurtures the whole person, encompassing mental and emotional resilience, financial security, social connectedness, and even a sense of purpose. This might involve training managers to support mental health, providing resources for financial planning, creating flexible work policies to reduce burnout, or designing workspaces that encourage movement and collaboration. The key is integration, ensuring these elements support rather than contradict each other and are accessible within the flow of the workday. Implementation is where many plans falter, and the text offers pragmatic advice for navigating this phase. Communication is paramount. Initiatives must be introduced clearly, with a compelling explanation of the what and the why. Removing barriers to participation is equally crucial. This could mean offering programs at various times, providing on-site options, or ensuring digital tools are user-friendly. The book also tackles the delicate issue of incentives, advising against coercive measures and instead advocating for rewards that encourage voluntary, sustained engagement and celebrate progress rather than just outcomes. Finally, the work underscores that launching a program is not the finish line. Continuous measurement and adaptation are essential for long-term viability. This involves tracking both participation metrics and, more importantly, outcomes related to health indicators, employee sentiment, absenteeism, and even productivity. By regularly reviewing this data and soliciting ongoing feedback, organizations can learn what's working, abandon what isn't, and iteratively refine their approach. This cyclical process transforms workplace wellness from a static campaign into a dynamic, evolving part of the company's ecosystem, ultimately contributing to a healthier, more engaged, and more resilient workforce poised for success.